Good day, everyone. Today we're discussing a medical emergency every nurse must recognize early: shock. Failure to identify shock promptly can result in organ failure and even death. The shock occurs when the circulatory system fails to deliver enough oxygen and nutrients to tissues. When this happens, cells begin to malfunction and organs can eventually fail. As nurses, recognizing the early signs can save lives. There are several types of shock. Hypolimic shock occurs due to fluid or blood loss. Cardiogenic shock results from failure of the heart to pump effectively. Septic shock can develop from overwhelming infection. And neurogenic shock results from disruption of nervous system control.
Remember this important principle. The earlier shock is identified, the better the patient's chances of survival. Never ignore subtle signs of deterioration. When the body enters shock, it tries to compensate. The heart beats faster, blood pressure begins to fall, and blood is diverted away from non-essential organs. You may notice confusion, reduced urine output, pale skin, or weak pulses. When managing shock, always prioritize the ABCs: airway, breathing, and circulation. Administer oxygen, establish intravenous access, and closely monitor vital signs. Prompt intervention can prevent progression to irreversible shock.
Before we conclude today's lesson, does anyone have a question?
Sir, what is usually the earliest sign of shock a nurse may notice?
Excellent question. In many patients, tachycardia is one of the earliest compensatory signs. The body increases heart rate to maintain adequate blood flow to vital organs. That is why continuous assessment is so important.
Excellent participation today. Remember, early recognition and timely intervention save lives. Please save this lesson, share with your colleagues, and follow Nursing with Richard for more nursing education content.